I want to bring in Dr. Ashish Jha, Dean of Brown University School of Public Health. It's always good to see you, Doctor. When we hear that California has already declared a state of emergency, how concerned should the general public be?
Yeah, so first of all, thanks for having me back. Look, the risk to the general population remains low for now. And I think the key is for now, we got to get ahead of this thing. And there are a couple of things we need to be doing. Obviously, for cows, this is becoming a real problem. A lot of them are getting sick and not fully recovering. For dairy farms, it's a real problem. And then we've got to do the preparation around vaccines and testing and treatment that in case we start seeing this spread more among people, we're ready to go.
So California, as I mentioned, is the nation's largest producer of milk. Let me ask a basic question. Is there any risk from drinking milk from a cow that might be infected?
Yeah, all the evidence so far says pasteurized milk. Pasteurized milk is very, very safe. Unpasteurized milk or raw milk, which has become increasingly popular in certain circles, always risky, substantially more so now. So very strong recommendation is do not drink raw milk or unpasteurized milk, because that may be an effective way of getting bird flu infection, which you want to avoid. But the data so far on pasteurization has been very, very clear. Pasteurized milk, which is what most of us buy in the grocery store, very, very safe.
Former White House senior advisor who worked on infectious diseases, someone I know you know, Dr. Nahid Bhadelia, tweeted this. To me, it feels like playing Russian roulette with immense number of chambers, but without knowledge of how long we have been playing or will be playing. That's why every new human case, change in viral behavior, circumstance, and mutation are making everyone jittery about other shoe dropping. Why hasn't the bird flu pandemic started? Now that we have this severe case in Louisiana, are you concerned about mutations? Are you concerned that this could indeed become something truly serious?
Yeah, look, for many of us, bird flu has been something we've been tracking for 20 years. Why bird flu for 20 years? Because in the past, it tended to have a very high mortality rate. About half the people who got infected and were cases ended up dying. Obviously, we have not seen anything like that, thank goodness, so far with this outbreak. But what Dr. Bhadelia raises, which I think is a very important point, is that, right now it is not spreading human to human, thank goodness. Right now it's not killing a lot of people, thank goodness. But those are two things that can change on a dime. And so the question is, how lucky do we feel? Do we want to keep pushing our luck? Or do we want to start planning for a potential outcome where the virus mutates, starts spreading from person to person, becomes more lethal in that context? I think we should be preparing for that. Even if it never happens, we should be prepared for that.
I'm assuming that at the center of any planning, Doctor, would be the CDC. And the other big story we're covering today is the looming government shutdown. Should we be worried if the CDC is having to close its doors, except, of course, for essential employees? Should we be worried if, as it's been suggested, their ability to track flu and bird flu cases goes away?
Yeah, the chaos in Congress goes even beyond that. So to answer your question directly, absolutely. Like, we need the CDC to be able to go track cases and find where people are getting infected. That is essential work. But the truth is that this Congress has become so dysfunctional. If it was a functional Congress right now, they would be giving money for vaccines so that we can build out vaccines so that if we get more spread of this virus, that we're ready with brand new vaccines. There is none of that funding coming. They would be funding testing so that we can track the virus. If you remember back in 2020, why was COVID such a problem? We didn't have tests, we didn't have treatments, we didn't have vaccines. We can get ahead of all of that right now, but it does require a functional Congress, and I'm deeply worried this Congress is not sort of living up to its responsibilities.
Well, to do that, you would have to have more people potentially in positions of power who believe in vaccines in the first place. But Dr. Ashish Jha, we should have that conversation for sure on another day. Thank you, and happy holidays to you and yours.